Okay, so today I'm going to show you how to set up a dashboard, and then I'll show you how to work with the charts that are part of the dashboard, which is a graphical view of key areas that show your agency's performance. And then I'll show you something we call the whiteboard, which is more like minute by minute reporting of things and activities that occur in your agency. And once we get through going through dashboard, then I'll take you through pretty much a full-blown work basket so you can see how all of that functions. So let's get started with dashboard. So the first thing I want to do is get dashboard set up. So I want to go to budget. So you do have an area in here to add a budget for your agencies. There is one chart that looks at compares actual revenue in the system to your budget. And there's, excuse me, there's another chart that looks at your direct cost to actual cost based on the payroll reporting. So I'm going to go ahead and add my budget. Now there's 4 different ways you can add a budget. You can add it, I'll just select one of these sitting out here. You can add a budget yearly. You can add a budget quarterly, or you can add it monthly. A lot of smaller locations do a yearly budget. I have found that larger locations are doing quarterly or monthly, especially those that are in a seasonal environment. Okay, I have a question. Is the dashboard view for all associates, or is this permission-based? Dashboard is permission-based. So typically, more supervisors or managers look at dashboard. I don't think you'd want to give it to accounts receivable people. There is one for associates that you could assign to HR people, so you could see some of the trends and changes for that. So yes, you can pick and choose the individual pieces and who you want to assign them to. Okay, so again, you can put in your projected revenue and projected direct costs, which is really your caregiver payroll, into the budget information. I'm just going to select yearly. And when I'm doing the budget, if I were doing this quarterly, there'd be 4 lines here. So you'd be able to update it quarterly. And if you were going to do it monthly, you'd have 12 lines to update here. 1, 2, 1. Oh, that's good. Okay, so once you have your budget in the system, it will compare actual information like revenue to budget. And I have another question. Can you add department budgets or only the agency budget? Are you referring to your home health, hospice, and private duty? Because in your environment, those are set up as separate agencies. So you'd be adding a budget for each agency if that's what you're referring to. But departments, because you're really dealing with revenue, it sounds more like you're working with an agency budget. Okay. And so once you get your budget in, then you can set up your dates. Now, there are several different date ranges, and let me just go ahead and explain to you the difference between the two. There's something called a 445 cycle, and the 445 cycle records every 4 weeks, as a month's worth of revenue. And then the third one would be the 5 weeks, and that would be that month's revenue. So when you look at the 445 cycle, we've already plotted out the dates for the year. So you can see that this year it starts on January 1st, but 4 weeks ends on the 28th. So that's 4 weeks, which equates to your January revenue. Then for February, it starts on the 29th of January and ends on the 25th of February. That's the second 4 weeks. Then for March, it starts on 2/26 and ends 4/1. So that's the 5 weeks. So that's why it's a 4/4/5 cycle. Most locations that use this 4/4/5 cycle report all of their revenue on a weekly basis. So you can have your dashboard chart set up so you can see them for those week time frames. So if you were to select the month of January, you could see things that equates to how you reported. Most locations use the calendar month. So if you're using the calendar month, that's exactly what it is. It's the first to the last day of the month each month. So once you set this up, just hit your save, and it'll add those dates. So you'll have to do that every single year. Now, the third one has to do with the matrix, and these should be some standards that you'd want to measure up against, either from a performance perspective or what you think the industry standard should be. So I'll give you the first one. The first one is for your associate productivity. What this does is it takes a look at the productivity for all your full-time caregivers to make sure that they're meeting your productivity standards. In the industry, the value is anywhere from 22 to 25%. So 25% would be a good baseline. Now, in the organization pay rates file, you can establish the weighted visit calculation. So if somebody was to do an assessment visit, you could calculate it at 2 units. If somebody was doing a reassessment, you could have it calculated as 1.5 units and so on. And then when you're doing regular routine visits, they get counted as 1 visit. So this associate productivity does look for those weighted visit calculations to do the right thing. And so when it's calculating this information, if they did 2 assessments, that count as 4 occurrences. If they did 3 routine visits, it could count as 3 occurrences. So right there, you've already got 7. Now, and if you were doing research, it would count as 1.5, but that's what you put in for your weighted visit calculations. So the intent of this is to make sure that your full-time caregivers are productive. Otherwise, they probably should not be full-time caregivers unless they're also doing some work in the office. So that's the intent of this. So when you look at one of the dashboard charts, you'll see that it shows those that have met your productivity standard versus those that have not. A lot of times, locations that give benefits, they use that to determine what they get for vacation or sick time, number of hours to get paid, and then locations that do provide healthcare benefits that usually insurance companies want to know on average what they did for a 13-week time frame. So that will help you with that too if you're providing that type of information. Then there's a matrix for associate turnover, and what this does, it just draws a line on the chart, and if you're below that number, you're okay. So what you're really saying here is you don't want any more than, in my example, 22% employee turnover in any given month. And so if you're about that 22%, then you probably need to take a closer look at why people are leaving your employee. So typically when you do, when somebody is leaving, you typically sit down and do an exit interview with them and find out the reasons that they're leaving your employee. Some things you can't do anything about, like they're moving out of the area. They may decide that they want to retire or do something else. Maybe they don't like the job, but then if they come back at you and say, I don't like how I was trained, I don't like my immediate supervision, the work just seems to be more tedious. Maybe those things you can take a look at how things are occurring and you can reduce that, because we all know that It's quite expensive to advertise, interview, check job references, hire, train for somebody to turn around and walk out the door in 3 months. So that's what this does. It just says, this is where I want to be below this bar. And so 22 to 25% seems to be the industry standard for the home health industry. Average days to bill final claim. My average days are set at 45. I think the production environments are not changed. And what the 45 days says that from the from date of the invoice, I have 45 days to get it out the door. So that really means for a 30-day invoice, you have 15 days after that's over to get that invoice out the door. So you'd want to make sure yours would be set at 45 days. You could have it set lower if you want. Some locations have theirs set at 35 and 40 days. I think they can get their final claims out the door within 5 days after the end date of that bill. So that would be up to you how aggressive you want this to be. But if it goes over 45, you probably need to start taking a look at it, your process, to see why it's not going within that standard time frame. Average days to bill wrap. So this says that you want to make sure your wraps get billed within that 5 days. So that could be an issue now that the PDGM for 2021 says if you're after the 5th day, we're going to start reducing your reimbursement rate based on the number of days you're late from day one. So I'd be inclined to set this at day 3, just so that I can see how much I have going over day 3, because getting it out the day on day 4 or out the door on day 5 is really pushing it. Then this average length of stay, this is not in your production environment, but since it's on my screen, I'll just tell you that we had a chart for this years ago and we took it out. We just didn't take it out of my training environment. So there's nothing you need to deal with for the average length of stay at this point. Okay. So that's the matrix. The top 2 are for all of your agencies: home health, hospice, private duty. Your wraps and final claims are for your home health agency, and you do have a separate set of charts for your home health agency that pertains to those. All right, the next thing you want to do is enter your agency costs. And this, you would use your previous year's cost report that you'd filed. So you would put in your average cost per visit. It's really for the PPS or PDGM calculation. So that's what this does. So when you complete your cost reports, they usually file them by March 15th. When you complete them, then you'd want to put that information in here. Now this works for every service code that you use. So you could have an RN that has 20 different service codes. You want to make sure this gets set up for every service code. We do have offices that are not putting this information in. They just don't get that part of the measurement on the chart. So, but I find it useful because then I can see what's going on, comparing my costs to what I'm actually using for the current year. Okay, once you get your dashboard all set up, then we get to work with the chart. So I'm going to go back to my dashboard menu, and this time I'm going to select my chart. Now you can merge your charts together between your home health, hospice, and private duty agencies. It may not be very meaningful to you if you do. So because you have 3 distinct operations, you might just want to select one of the agencies out of there. So you'd want to select your home health agency, your hospice, or your private duty. So I've got my agency, and I'm going to select the year that I want to work with. Since we're right at the beginning of 2021, I don't have any data, so we're going to go back a year. Once you select the year that you want to work with, it's going to present you with a bunch of buttons sitting up here for quarters, months, and year to date. If you select one of these buttons, it's going to populate the date range automatically for you. So if I selected Q2 to give me the date range for the second quarter, I selected a month, it would give me the date range for that month. Now you can change this date range. I've seen where somebody wants to look at month 1 and month 2 together, so you could look at January and February as a date range. I've also seen people that want to look at this every single week, so you could put in the date range for the week you want to look at. What you can't do, excuse me, is cross over years. So I couldn't enter December 1st, 2019 through January 31st, 2020. So you won't be able to cross over years because it works with a full calendar year. Several different chart categories. All three of your agency types will have financial charts. All three of them will have the admission, the census, discharge. Your home health agency one will have the PPS, and all three of them will have the associates. So these are the chart categories you have. So each one of these categories has a set of charts associated with the category. Now, sitting over under payer reports grouped by, you have your choice. You can have it create the charts by the payer category, and the payer category, those standard categories that are Medicare, Medicaid, insurance, private pay, those are your standard categories. Or you can have this by payer reporting group. So within each organization payer, you can have a specific reporting group assigned to that payer. These reporting groups are very helpful if you need to break apart a payer category. The best example here would be for your home health. You can have Medicare Part A. You can have Medicare outpatient therapy. So if you're doing that, that should probably have its own reporting group. There's also some payers for Medicare payers for demand denials. So in all, there could be 4 payers. If you want them all grouped under Medicare, they're all attached to category. If you want to break them apart so you can see them separately, then you could see what your Medicare Part A was doing versus your Medicare outpatient therapy and so on. So you could use the reporting groups to do that. Also, where that comes in handy is if you have managed care payers, or maybe you have 3 or 4 different Medicaid waiver programs and a Medicare, a Medicaid home health, and one that you can also bill for hospice. If you break them up by reporting groups, then you can see the information separately. So that's where these reporting groups come in handy. I'm going to leave this at payer category. I want to start with my financial charts first. Now, because I don't have a lot of data sitting in my database, my charts look kind of goofy, and you'll see that as we look at them. So here's my budget to revenue. It's comparing my actual revenue, which is based on services verified, to what's been budgeted. And so if you don't put the budget in, you just don't have this line on the screen. So you will still get to the revenue piece. Now, this one shows revenue payroll margin trend. So you can see revenues, the blue bars, payrolls, the gold bars, and the gross margin is the line on the screen. You have your gross margin by payer, and not doing too bad. This shows all negative stuff in my environment. That's why I said that this information on these charts is going to be much more meaningful to you when you look at it with your actual data. Because you can see I've got some goofy stuff in here. And then you see invoices and cash flow trends. So you can see invoicing when it's going out the door and when you're getting payments in. Now, if this was true, and I was responsible for invoicing, I would expect to be coached and counseled for 2 months that invoicing didn't go out the door. So this just helps you manage this to make sure that your invoices are going out timely. I don't think I'd ever want to see one that shows 0 for any given month that I haven't invoiced. That means that I'm not getting payments in the door. And as you can see, I have the same issue with my payment trends. Come September, I didn't get any payments. So again, I would, if this were me doing the work, I'd be expected to be coached and canceled. And if it didn't improve, I'd expect to be terminated. Okay, aging profile. Mine is one great big black dot because all of my items are 91 plus days. Hopefully your aging profile will be more colorful than mine is. So you can see that you've got different colors um, for the different time frames, 1 to 30, 31 to 60, 61 to 90, and so on. So hopefully you have a much more attractive aging profile. But from a collections perspective, I probably don't want to ever see anything sitting out here in the black. So hopefully you'll have the blue, goldenrod, and possibly red. Now, to work with the charts themselves, you can see what's on the chart, but you want to know what creates the chart. So if you select the header will give you the detail information that created the whole chart. So since I'm looking at a chart for a whole year, this gives me everything for a whole year. If I was looking at a month or a quarter, it would just give me the month or quarter information. So here's the detail that created the chart. You can export the chart into a spreadsheet. So if you need to work with this data, you have a report that you can get that actually created the information that's on the chart. So again, the headers, if I select any of the headers, this is the one for the revenue payroll margin trend, gives me all the information for that chart, and I can export it. Can do the same thing with the gross margin by payer, and here's all the information for this one. So you do have all the detail that creates these charts. The other thing about the chart is you can hover over any particular portion of the graph and it'll give you the information. So in this case, I'm hovering over May, and this gave me 31,500 plus for revenue in June. I can see my 34,000 sitting in June, July, and so on. When you have these little lines on here, if you hover over the dots, you can see what it was. So this particular one has the budget entered by month because you can see that it's changed. Same with this type of chart, these line graphs. If you hover over any of these, you can see what the gross margin would be in this case because this is the red line. And of course, when you're looking at like this invoice and cash flow trends, hover over the little dots on these, and you can see what's being done. Okay, so that gives you an idea how to work with the financial charts. So I'm going to move over to the admission census discharge charts as well. Now, this one gives you more information by the payer category reporting group versus using the actual reporting group that's attached to an organization payer. So I've got this one set up as payer category. So you've got your admission and trends, so you can see admissions and discharges for the reporting time frame. You can see the admissions by payer. So if I were to do this by payer reporting group versus payer category, then this would show me a different chart here. Same with census by payer. Since I ran this for payer category, this gives me the categories. Anytime you change these, and you want to look at reporting group, your legend for these that use the reporting group versus the payer category, those legends will change. Now here's an example of a stacked bar graph. Now you can hover over each section on this. So in this case, the one I'm hovering over says I have 32 Medicare payers that were active in this month. I have 4 Medicaid, 12 insurance, and 4 private pay. If you want to add these up, you can take 30 plus 4 plus, or you can just run a report, and that'll give you the information that created the chart, and then you can export it. And now here's a more colorful pie chart. So if you hover over these, you can see the figures, and you can actually select on one of those sections to get the report just for that one section. So this was the total for just the insurance versus the total for the entire chart. So all of these have the same type of information, and they all function pretty much the same way to get to the detail. You just select the heading for the chart, or if you want to get to detail for one specific portion of the chart or the graph, then select that portion. Now here's where your non-admit statistics are. So in the adding a referral on the Create Referral page, which is page 1, you can determine that you're not going to go any further and not accept that referral. And so you would assign a reason for why you're not accepting the referral. These are the reasons that happen to be in my table. I think you should have some of these same reasons. And so you'll be able to assign them. And once you go through the full 4-step process and create a pending patient encounter, you can then turn it into non-admit if you decide at that sometime after you've created the pending patient encounter to make them a non-admit and assign them a reason. Okay, I have a question. Can we add categories in the non-admit? Yes, you can. This is under the settings menu. Look up tables. Should be under the patient support tables. Oh, now you're going to question my referral. Maybe it's under general. You do have access to update this table. Just right off the top of my head, I couldn't tell you where it's at. Okay, so it does say reason. Maybe it just says reason. Let me try it again. Should be under the patient. Place of admission, transaction. Oh, right here, decline reason type. It is under the patient's one. So that's you take your lookup tables, patient support tables, and decline reason type, and you can change the descriptions to anything that's existing on the table. You can add new items to the table. If there are items on the table you don't want to use, you can end them. So you do have access to update this table. Okay, so that's the admission, census, and discharge charts for you. So let's move over to the PPS. And if you're selecting a hospice location as well as your private duty, you probably should not have this chart category in your dropdown when you select that type of agency. This is truly for your home health agency. Now you've got several different items sitting out here for the charts. Here's your total unbilled. Now, since we labeled this PPS, it's really the PPS and PDGM, there are some non-Medicare payers that are still using the PPS logic that didn't switch to the PDGM logic. So all that information still shows up under the same chart category. So when you're looking at one that's for unbilled, for example, if it says RAP that's unbilled, which is these are the RAPs that are unbilled, that's for every payer, not just Medicare. So every payer that's doing PPS or PDGM that the RAP has not been billed will sit in here. Then your final claims, all of those that are waiting for final claims to be billed for all your payers, not just Medicare, they will sit here. So these are the pieces that are compared to the whole. All these other services are all of your other unbilled invoicing. So it's not associated with the PDGM. We're just comparing these two to your total unbilled services. So that's what this chart does. You do have an average case mix weight. So you'll be able to look at this. These are really the standards that CMS publishes every year for a previous year. So they actually change their case mix weights based on the 432 HHRGs that they've set up for patients. So this gives you an idea of how to compare that to your what the standards are for that year from CMS. Average days to bill, wrap, and final claim. Now, especially with the new environment, I certainly would not want my wraps sitting out here for 65 days because you just lost the revenue for that entire certification period based on the new process. So this is where we built the matrix for 5 days. That's the line for 5 days, and here's the line for 45 days. So that's what we put in the matrix. I definitely want my reps on or below the red line, and I definitely want my final claims on or below the black line. So that's where the matrix comes in. Also have a chart sitting out here for average visits per episode so that you can see the number of episodes. Now this one, I tend to like to look at the details that created it so I can see what's going on with it. So this is one of those that I would probably prefer to run the detail, even though I've got a nice chart that gives you all of this information. I just like to see more detail. This is your PPS cost analysis. This compares your projected revenue to your projected cost. And your projected cost comes from this agency cost. So it's not really looking at what you're actually paying your associates for this chart. It's looking at this agency cost. Then we do a comparison of LUPAs to all of your PDGMs. So if you had maybe 3% of LUPAs, they would be listed here compared to all of your invoices. So you'd be able to see that comparison. Also have the Oasis certifications where when you initially put it in, you have set this up for your Oasis certification. So when there's a change in condition, you're creating, and I think it comes from the resumption of care assessment, and you'll be able to see those certifications that at some point during that certification period, there was a change in the patient's condition. Your clinical group categories. Now there's 12 of these. I just happen to have everything linked to this one. So again, this is another one of those charts that looks kind of goofy because I have minimal information in my system. So hopefully this chart looks a little better for you. If you're using all of them, the legend will show you all. If you use 7 of them, it'll show you 7. Then you have your total number of invoices and those invoices that have the comorbidities attached to them so that you can see that comparison. Are your functional scores? You can see what the functional scores are. Like I said, my charts do not look good because I don't have a lot of information to create them. So when you're looking at this in production, it'll give you your functional scores. Then you have those that are classified as institution versus community. In Oasis, I think it's M1005. That Oasis is where you tell whether it's going to be a community or an institution. And we use that same M1005, that whole section, to determine whether you're billing for communities or you're billing for institutions. So that's the section in Oasis where you put in they were in some type of facility and hospital stay, or you would post it as an NA. That's where that comes from. And then you've got an average days to transmit Oasis. I don't think you ever want to see this because this is listed at 88.1. This is the only time I've ever transmitted by Oasis for the entire year, so that's not a good thing either. So you would like to make sure that your average day should be 7 or less. That to me would be my comparison is you want to make sure that that process is set up in your agency. So whoever was creating the transmission file does that at least every 7 days, if not more often. So my thought to this is this should be way low, not way high. Then I've got the re-hospitalization. So when you are discharging a patient and sending them to a hospital or a facility, when you document that information in, I think it's M906, 903, and 906, that's where we pick that from. So that's where that information comes from. So we're comparing all of the Oasis that you've done to those that you transfer to a hospital. Okay, so those are your PPS charts. Now we get to go to the associate chart. Now, when you're on the PPS charts, you still have the ability to select the headers, any section on the graphs to get to the detail. Okay, this is the associate chart. Now, if you recall, I said that my associate productivity had to be set at 25. Do I have a question? Okay. If you recall, I said that for my matrix, my standard productivity for my associate was set at 25. So here's the 25. This chart is the only chart you cannot select the header. So even if you tried, you wouldn't get anything. When you're looking at the information in this chart, I ran this one for the entire year. It gives me the last 13 weeks of the time frame I ran it for. If I ran this for a month, I will still get the 13-week time frame because I need to have a rolling 13 weeks all the time for this so you can do the comparison. Now, if anybody met their productivity standard, they would show up in this bar graph in green. They would sit above this line in green. And so if you needed to look at one specifically, you can click on an individual one and see what that individual piece looks like. So for this week ending 11/13, my standard's 25. This person did 6 and this person did 1.75. Now, if that's consistently the case, then this person shouldn't be classified as a full-time caregiver. There are some situations where you might be close to it, that if you are close to it, you could let that slide a little bit, especially if they pick up the slack in another week. Because again, the rolling 13 weeks is what you typically would use to measure for times for vacations, PTOs, and any healthcare benefits. So that's where this comes from. Okay, I have an associate tenure by classification. Classifications are full-time and part-time. So you can see I've got 0 to 1, 1 to 3, 3 to 5, 5 to 10, and 10 plus years. I'm doing a good job keeping my employees entertained. So that shows you full-time and part-time, and then you have your current associate tenure, and it doesn't matter whether they're full-time or part-time. How many you have, 0 to 1, 1 to 3, 3 to 5, and so on. So that's where that pie chart comes in. This is by full-time and part-time, and this is your total overall associate file. Then I've got one for associate census. So my associate census has three pieces to it. You can see what the full-time count is if you hover over these little buttons. You can see what the part-time count is if you hover over these buttons. You can get the full count if you hover over the bar. And so that gives you all the full-time, part-time associates, and then you can create the report if you need to see the detail that created it. Okay, so here's your average or your associate turnover information. So you can tell by my chart that I'm doing an excellent job. Nobody's left in the whole year of 2020. If I did have somebody leave in any one of these months, it would be posted here. It would also identify whether they were full-time or part-time. So this is the line that I drew in the sand. So in the matrix, I set this up at 22, so I don't want it to be any more than 22% at any given month. So if I am constantly terminating people and it keeps rising for the month and it goes above my standard for my agency, then I'd want to take a closer look at why they're leaving and see if we can make some corrections to it. Okay. The per diems are classified as your part-times. In our system, the per diems are part-time. Either you flag somebody full-time or you flag somebody part-time. And the part-times are also classified as per diems. So that was a question I had, what about per diem employees? When you're working with your associate turnover, they are all included in here. So if you terminate a per diem, part-time, full-time, it will show up in the associate turnover. So I think we just call it a little bit terminology, but per diems are typically your part-time people. You do have another chart here, and for some reason we haven't figured out why it's not displaying, but I'll tell you what the chart is. It identifies your caregivers that have the highest caseloads. How do you set up the productivity piece? My question is, how do you set up productivity for a per diem? There's another report that you can use to look at productivity for everybody. Your full times is part-time per diem. This report that sits up here is just for your full-time associates. So that, like I said, there is another report that's for that you can look at. I'm not sure if I have it set up in this piece, but there's another report that's sitting in here where you can see what they actually are doing week after week or any time frame, reporting time frame you want. So that's where that one sits. My security access doesn't show that one, but it's in the reports menu. And it says, I think it says associate productivity. So that's where it'll be sitting. So you don't have to establish this person has to do 10 visits and this person has to do 12 occurrences and this one has to perform 8 hours and so on. This just shows you what their productivity is. This piece here is just for your full time. Okay, so back to this no name, no data to display chart. This chart has your caregivers that have the highest caseloads, and it will list the top 5. And so when you see that, you'll see their names, and it'll compare them from one time frame to a previous time frame. So if they've worked for you for years and you have them in the system and they've been in the system for several years and they're one of your top caregivers, they will sit at the top. You'll see current year and prior year. If you run this for a quarter, you'll see current quarter and prior quarter. And if you run it for current month, you'll see current month and prior month. So that's what this one does. Now, there are locations that think this is a good thing, but there are also locations that think this is not a good thing. Because typically what I find is schedulers will find and assign associates who always accept assignments, willing to do anything for you. They're loyal, they're predictable. So they typically get the majority of the scheduled services, and you have other people working for you that don't. So it might mean that you need to look at how you're scheduling and assigning the services to individuals so that you make sure that you share the caseload. So some locations give them a party or an award or something when they're in the top 5 group, and other locations do a combination of that and saying we need to look at rescheduling some of their services. I can't have somebody working 50 hours a week and this person sitting over here is only working 5. So that's the chart that sits here. It's like a double-edged sword. It could be a good thing and it may not be a good thing. Okay, so that's the dashboard chart. Like I said, it's going to be much more meaningful to you when you see your actual live data on these charts. I just wanted to give you an idea of what the charts were and how to get to the detail that creates the charts. Okay, so I'm going to move on to the whiteboard. Whiteboard is a minute-by-minute time reporting, or it's more than time. It's a minute-by-minute reporting of all the activities in your agency. And so I selected my agency for this, and it can be minute by minute. It is set up to refresh it every 3 minutes. You can change it to 1 minute. You can also change it to 5 minutes. Now, I'm going to leave it on 3 minutes, but if you have this set at every minute, anytime something changes that appears on here, the screen's going to refresh and that change will be here. So most people do leave this at 3 minutes. I think I see more senior management change this to 5 minutes. So what it does is it shows you everything that's pretty much going on in your agency all the time, every day. So you'll get your active census, you'll have your certifications requiring review and lock, you'll have your non-exported Oasis information, you'll have your pending certifications, schedule services requiring some type of action, like your unverified services. That means that in this case, I have 1,529 services that need to be verified to create a billing record and a payroll record. That, in some agencies, that would be terrible. In other agencies, this might be 1 week's worth of work. Like I said, these counts may mean something to you. So if you know that you're doing, let's say you're doing 600 visits a week and you saw 1,500 visits sitting out here, that means that you haven't verified services for 3 weeks. So not only have you not created payroll records, you've not created the billing record. So that would be your clue that something's going on in the process. Now, as services are verified, the numbers will go down. You go and look at the next day, the numbers could go up again because they add the next days to the verification screen. Then for your unscheduled, these are your services that appear on orders 485, any interim order that has services on it, your care plan. These are for those services that sit here. And this says that you have not assigned a caregiver to them. So if you're a large agency, might not mean anything, but this could be you haven't assigned somebody services to individuals for 2 or 3 days. That may not be a good thing, so it'll help you. As somebody assigns them, then this number will go down. When you go and look at the next day, if you've added more services as unassigned to patient schedules, it'll go up again. And then as they continue doing assignments during the day, it'll start dropping. So that's what we mean by minute time reporting. So if somebody verified services within 3 minutes, and they verified 20 services within 3 minutes is withdrawal. So when screen refreshes, you see the numbers change. Okay, on this whiteboard screen, anywhere where you see orange font that's underlined, these are links that'll take you to somewhere within the application. So for this one, it's going to take me to the patient encounter. So I'm in the patient encounter, so if I need to get there quickly, I can. If I want to get to those that are unverified, if I click this link, it'll take me to the unverified screen. Okay, so this one, there's another column, the third column, your deaths and discharges. This will show you everything that's going on current month. So we're in the month of January, so anything you discharge, whether they've expired or it's just a general discharge, it'll all be written here. When the February 1 rolls around, then those go away, and then it'll start looking for your discharges and deaths for the month of February. So since this is all current activity ongoing all day long, there's no place for you to put in a date range for you to pick anything. So we just gave you a full month. When it rolls into a new month, then it'll go away and you'll start it over again. Then for your pending referrals, these are the referrals that you entered into the system that you have not scheduled the initial assessment visits and assigned them to associates. So that means that I've got them this far, but we need to make sure that they get the initial assessment visits get scheduled and assigned. Now, once they are assigned to somebody, then they move out of this pending referrals and move into the scheduling referrals. So this now has an associate assigned to a scheduled service. So you'd see them. Patient has not been activated yet, so they will go into this bucket. Once you activate this patient that's listed here, then they will go into your active census. And as you discharge patients, then they'll be removed from your active census. Now, this caseload that's listed here is based on services that are assigned to these individuals. So that's how it's going to calculate the caseload from this screen. In your associated master file, the caseload report there looks at the team assignments that are on the clinical tab. This one looks at what you've actually assigned to these associates. So that's where this caseload comes from. Okay, a couple other things to note about these. We try to get as much information on we try to get as much information on here as possible. So we have to use some abbreviations and acronyms. If you hover over some of these that you have no clue what they are, like DL, it'll tell you what it is. So that's the disaster level. This one says LOS, so that's length of current encounter. This one says CTY, but it's city. You can see case manager, and you just saw my screen refresh. And all of these have initials listed below them. If you hover over this, it says inpatient stay, and so on. Okay, 2 questions. Actually, the question's in 2 parts. This, I'm going to turn it into 2 parts. This screen you select by agency. So I don't have a hospice agency in my group. The one that I have set up for here is all set up for home health. But if you have a hospice agency, you'd be able to select it. The dashboard will change. The dashboard will change so that you have information on here for your hospice location, like you won't have the rep sitting out here. You won't have this non-Oasis exported. You'll have his information and so on. So there are some changes is the agency you select from here as a hospice. So just keep that in mind that this will change. In Dashboard, let me go back because I'm through explaining this. In Dashboard, I'll go to the charts. You have the same thing. If you should have three agencies. You should have a hospice, a home health, and your private duty. So if you need the information for your hospice, you select the hospice agency out of this list. And so that'll give you the actual charts for excuse me, the actual charts for each individual agency. So it's based on which one you're going to select. So both the whiteboard and the chart, you can bring up by agency. Okay. So that takes care of the dashboard piece. So let's move on to Workbasket. Workbasket, if you have been assigned Workbasket at all, you'll have a link here. If you have no Workbasket items in here at all, it'll say you have no Workbasket items. That way you'll know whether you need to select this link or not. Then if you do have Workbasket items, it'll say you have Workbasket items. So I'm going to go ahead and select you have Workbasket items because I have them. All right. So when you're in Workbasket, Workbasket has a couple of interesting features associated with it. If you're an individual that created or updated information that created the Workbasket item, then you can have my tests checked, and it'll show me the ones that my sign-in created the Workbasket item. So that's what this does. I find it most useful for your clinical people because when you're creating information for let's say you were doing service notes and you have incomplete service notes, the service notes section in Workbasket tells you didn't finish them. Now, if you were working on orders and you're writing an order and you save it, well, that created a Workbasket task because it hasn't gone through the rest of the process yet. So you created that Workbasket task, so it's now your item. So like I said, I do find this more useful for the clinical group than the other areas because typically people that are working in the other areas, it really is their Workbasket. So if you have unbilled invoices you need to correct, you have payments you need to apply, you have invoices that you need to follow up on because they haven't been paid yet, but you sent the bill out 30 or 60 or 90 days ago, and so on. But I do find it very useful for the clinical people so they can see their information sitting out here so that they know they have things to complete. So if you don't have my test checked, then you get to see everything that's in Workbasket that you've been assigned to in Workbasket. So that whole assignment piece will show you everything if you check my test. These will just show you things you're working on that you created the Workbasket item for. You may not be responsible for the next step, but you can see that it's sitting out there because you created it. So that's what my test does. I'm going to go ahead and remove that. Also, you're going to have some people that have access to everything in Workbasket. Usually the care patient system administrators have access to every phase, every Workbasket item sitting out here. If you want to set your defaults, so this is all set, so I've got access to everything in Workbasket. If I just want to set my defaults, and I only want to see a couple of them. Maybe for this next week, I just want to concentrate on my accounts receivable information. So I can select that one and save it. I find that clinical people that set these up will set the defaults for the clinical sections and maybe the patient encounter sections. And so you could set those defaults. So instead of using my task, you can see everything that's sitting out of Workbasket. in that area. So for me, I am okay with seeing all of them. Depends on how comfortable you are. If you want to work on everything as you go through the list, you can do that. Now, Workbasket is divided into 3 sections. There's your action items, and that's really your electronic to-do list. It means you have to do something to either complete the task or move it to the next step in the process. There's one called case communications. Case communications, these come from the notes tab. So there's case communications that comes from the associate notes tab, and there's case communications that come from the physician's notes tab. So that's where the case communication information is coming from. Then there's one called notifications. Now, notifications, we'll give you that information as automated so that you can go in and look at your notifications and see things that may have occurred, such as when you add a referral, it'll tell you that you've added a referral. If you turn it to a non-admit, it'll tell you that you changed it to a non-admit. If you admitted it, it'll tell you you've changed it to an admission. And you would do this more for home health and maybe private duty. If you put the patient on hold, it'll say you put them on hold during that time frame. If you reactivate the patient that was on hold, we'll tell you that. If you discharge the patient. Now, in a hospice environment, you'd see the referrals, the non-admits, the admits, and you'd see the discharges. But the other ones who have patient status of putting it on hold and reactivating them during the same start of care. So we give you all that information. We also will tell you if you've received electronic remittance advices. So senior management, this would be a good thing because then you could see that they came in the door. Have I gotten anything today? So I just come to the notifications and say, wow, I've got 2 electronic remittance advices. And the nice thing about the electronic remittance advices, if you have non-Medicare payers, because we know they come from Medicare, but if you have non-Medicare payers that send electronic remittance advices, we'll tell you that they're there too. Okay, so let's talk about the action section first. Actions, these are the categories. When you're assigning Workbasket, they're also called a group, but these are the categories: accounts receivable category, associated clinical record, patient, referral source, and so on. So all of these are the groups. Below a group are the actual items. So these are the tasks: accounts receivable follow-up, invoice edit, and applied cash. And so these are the 3 that are under accounts receivable. Then below these tasks, you'll see, and in this case, these are patients, but you'll see a name listed here below the task. If I was looking in the associate's information, these would show my associate names. If I were looking at the patient, I would see the patient's name. It's something for the patient, I'd see the patient's name. If it was a physician that I was missing information on, I'd see the physician's name and so on. So you'll see the names that are linked to the individual items under this category. Now, there's a little number that sits to the right of these. This one for accounts receivable says I have 103 action items sitting out here. 66 of those are accounts receivable follow-up, 26 are invoice edit, and 11 are unapplied cash. Now, if you select the category like I have selected, this will show you everything for that category. So you can see invoice edits, unapplied cash, AR follow-up, and so on. So you'll see them all. If you want to concentrate on one of them, you just simply open up the list, and let's say you want to work on accounts receivable follow-up. So you select that. Now you see the list of all of those that you need to follow up on. They're all grouped together. So if this is something that you need to concentrate on and work on, then this is your list. Now, in your list, you have icons that they're called edit entity because it's really you need to either change or update something for a patient, an associate, a physician, a facility, and so on. So it's called edit entity. It's a link to take you where you need to go to possibly need to go to update some information to either remove this workbasket task or move it forward in the process. The names that show here are also links to take you to the same place. So, and again, these names can be patient, associate, physician, facility, and so on. So these links will take you there. So if I were to select one of these, you haven't seen the accounts receivable yet, but you're going to get a sneak peek. So I select this individual. So it's going to let me follow up on invoice 339. So I am now in the accounts receivable module, the notes tab. I can enter a note, so I could call this payer and say, when are you going to pay me? And I say, we promise to send you a check in 10 days. Then you could put the note in here so you can keep all of your collection notes and activity in CareFish, so you don't have to have any sticky notes wrapped around, any follow-up files, spreadsheets, nothing. You can put it all in the system with a follow-up date. That will take it out of workbasket. Then it'll go back in workbasket if you haven't received an applied payment within that follow-up date time frame. And so that's really how you'd be working with your workbasket. I'm just going to back this up so I can get back to this real quick. Okay, so that gives you an idea of how workbasket would function. Now, if I were going to go to the associate, most of these I think are out of compliance. This one says I have a renewal date approaching. So if I'm the HR person, I should have access to workbasket items. I can look at this and see. It says I have a renewal date approaching. So I'm looking for these dates. And it might be one sitting down here. So it'll allow you to get to where you need to go to update the information to complete that action item. So it keeps track of all that for you. So if I go to the clinical one, now the clinical one, you have a home health and hospice and private duty that you could have some clinical tasks for. I think your private duty will mirror closer to your home health. And from if you have access to all of workbasket for all three agencies, then you're going to have all this mixed together. So if you have workbasket where you're responsible for home health, you'll probably see Oasis missing. Like this one says Oasis missing. You'd see print and mail the orders or distribute them. You could have therapy utilization check and so on. So your hospice, you'll see his information. You'll see stuff about IDT. You'll see whether you need to discharge the patient or recertify them within a specific time frame. And so when you're working with the clinical piece, I'm just going to open this file up. You've got things like approval of certification, approval of interim orders, continue services or discharge, Oasis records missing, Oasis record not locked, pain response, which is for your hospice, physician visit date missing. These are your face-to-face dates it's looking for. Printed mail certifications, printed mail interim orders. There's a difference between discharge or continuous service. One of them deals with your private pay and the other one deals with your home health. And then there should be a third one for your hospice. So you're going to see a combination of things sitting out here for your clinical, and your clinical piece is probably going to be the largest of the workbasket items. And so just to give you an example of why I say it's probably going to be your largest, you start off with an order that's in the initiated stage. So it needs to get to the approval stage. So you document that order, but you're not through with it yet. and you save the information, you're going to come back to it. Now it's in the save stage. Still needs to get to the approval stage, so it's sitting in work basket. Once, if you're the person that's responsible for reviewing that and doing the final approval, then it'll take it out of the approved stage and give you a new work basket item saying that you have to print and mail or send to the physician. Then, once you do that, then it's going to create a new work basket task item that says you have to enter the received date for when you got that order back signed from the physician. Once you do that, it's no longer in work basket. So it's going to go through every step until you complete that entire order, get it signed, and so on. And similar things for Oasis. You can have an Oasis record missing that you need, or you have an Oasis record that hasn't been logged. You have an Oasis record that you need to sign somebody who's going to do the transmission. So that would be sitting out there. So there's a lot more components to the clinical record action category than some of the other ones, because you're moving at every step of the process until you're through with it. Okay. Now, when you're working in work basket, you see I've got some stuff that's color-coded. Now, I chose the clinical record because it's the one in my environment that's color-coded. When it first hits work basket, it's going to come in with a white font with a black background, or white background with a black font. That's the first time it goes into work basket. The person who is responsible for that day-to-day activity to get that accomplished, that task accomplished, will see it hit their work basket. And that individual, you will assign all three phases to. So phase 1, phase 2, and phase 3. So they will see it when it comes in phase 1 in their work basket. If it doesn't get done within the appropriate time frame, it gets escalated to phase 2. So phase 2 is typically their supervisor or manager. So the person in phase 2 won't see it in their work basket until it comes in with a yellow background, black font. And so the person that's at phase 1 gets to see in phase 1 and phase 2. Now, if it doesn't get done within an appropriate time frame while it's sitting in phase 2, then it moves to this red phase 3. Phase 3 is typically your senior management, so they would be assigned phase 3. So typically your senior management doesn't really want to know about the day-to-day activities if they're getting done timely. This is when they find out that they could have a potential issue. There might be a process breakdown that's holding this up. You may have doubled your workload. Maybe your admissions have doubled or tripled, and maybe you need to assign additional resources to it. Somebody could be on vacation or out sick or something, and nobody's picking up the task. Well, then your senior management can make the decision: do I interview and hire new people? Do we take a good, strong look at the process and make changes to it so that we can get this stuff more timely? Are we doing things we don't need to do? And so on. So that's why you wouldn't really assign them phase 1, because that's really the day-to-day responsibility for the individual doing the work. So they'd only see it when it comes in phase 3, so they'd only see it red. So phase 1, you assign them all three, or the person responsible for the day-to-day activity gets assigned to phase 1, phase 2, and phase 3. Then the person who's their supervisor or manager gets assigned phase 2 and phase 3, because they need to see it escalated if it doesn't get done while it's sitting in phase 2. And then those that you assign just phase 3 are typically your senior management. So I'm going to throw a wrench in this, and it's probably for you, Molly. Typical system administrators are assigned all 3 phases for everything. So you may see the full-blown work basket, which is what my sign-in looks like. This is really a full-blown work basket. So otherwise, if you were a supervisor manager, you may only see phase 2 and phase 3 colored. So, and we do recommend that you have at least one or two people that are assigned all of work basket, and we typically suggest that be the care vision system administrator. So you can assign that responsibility to somebody else if you don't want all of that sitting in your work basket. So just keep that in mind. That's typically what we do. So some of you may see everything even though you're not responsible for the day-to-day activity. Okay, so that gives you an idea of how the action items work and the color coding that you will see. All right, I'm going to slide down and go to case communications. Case communications is when this information is coming from the notes tab that's in the associate master file or the physician file. So those are the only two places right now that this information comes from. If I were looking at the associate one, which is the one that I am looking at, this one says change payroll from salary to visit an hour. In my mind, this is one of those tables that I think should be flagged that it does not create a work basket task item. Most of this information that's coming from the associate file should probably be kept and managed by HR. You certainly can set it up here so your HR people get it, and maybe your senior management gets it, but you kind of have to be careful because you might accidentally assign it to somebody else. So I would be inclined to make sure that table does not bring anything over from the associate master file except maybe their scheduling preferences. So you might want others to know that they don't want to work in they do want to work in a non-smoking environment, or they're only available nights and weekends, or they can only work from 9 to 3 Monday through Friday. That type of information you could put out there. My other favorite one is the document uploaded. I'm not sure why this even posts out here. It doesn't tell you anything. So I probably have the majority of those things, if not all of them, flagged so that they stay just in the associate master file for your HR people and who have access to that versus sending those notifications to others. Now, when you're working with these notifications, I'm going to switch this to referral source because this one's a little better set up. These are the types of things that are sitting in my physician master file that brought the notifications over. A physician is affiliated with these facilities. This physician uses gun labs. Their office hours are Monday through Friday, 8 to 6, Saturdays 10 to 2, and closed Sundays. This is their contact, prefers to be called in, faxed, or emailed. And this would be a general note. Physician is relatively new to the community. Now, in your work basket, you're going to have their names sitting here. They just don't happen to show up in my training environment, but in your work basket, you'll see it. I have a question. You may have covered this yesterday. I was not on the call. If not, is there a work basket report to track insurance authorizations approved or pending? There are 3 different authorization reports that you have access to. One tells you if authorizations are missing. One tells you if authorizations are about to expire or have expired. And the third one tells you all the authorizations that you have in the system, and they compare them to your scheduled services as well as services you verified to see how much authorization you have left over based on those payer requirements. So there is a report that will give you all that information. So a pending authorization, because the the organization payer would identify whether it was an authorization or not. Those reports will tell you if one's missing for a new one, so that could be classified as a pending authorization. Also, in scheduling, when somebody goes to schedule and they're scheduling for a payer that requires authorizations, there are two options for this. One of the options is they can override that scheduling or that authorization warning message and assign services anyway. The other option is to set it up so that they cannot override and schedule, assign and schedule those services to an associate unless they have the authorization in the system. So there's other checks and balances to that. If you decide to use the override for authorizations, where you can go ahead and assign scheduled services anyway, the reports are going to tell you that you have more services than what you have authorized. There will also be another check when you verify services that says the service has no authorization. So you've got a couple other checks and balances in the system to look for authorizations. So, and that report, let me just slide up real quick. That report sits under the reports menu. It's these three authorization reports that should be working with. Okay, so back to Workbasket. All right, I'm sitting on my case communications. This is the information for my referral source, which is my physician. And once I've read this, I want to remove it. So I can remove this from my Workbasket. I can check one, multiples, or all, and hit my delete. Now I'm deleting this from my Workbasket. So these are my case communications that are unique to my finance. So if 10 people receive the same case communication information, then they will see all 5 of them until they delete one or multiples or all of them from their own Workbasket. So this case communication section is unique to each individual user sign in. So I deleted those. If you get this access, you'll still see them in yours until you delete them from yours. Okay, so for notifications, these are those electronic notifications that we give you. My example shows that I have the ERAs sitting out here, which are your electronic remittance advice, and you can see that I got them from several different payment sources. So Blue Cross, Cigna, and so on, multiple patient clearinghouse, and this is all the information that's set up that I received ERAs for. So this particular notification should be assigned to the individuals that probably manage accounts receivable and apply cash. And probably your senior management would like to know that payments are coming in. So that's where this would be. And this works the same way as the communications. I can delete them from mine and they're still in everybody else's until they delete it from theirs. Now here's my referral admissions. I have 3 new referrals I've got entered into the system. If I change the referral to a non-admit, it'll tell me non-admit and the patient's name. If I change it to an admit, it'll tell me that it's a new admission. It'll give me the patient's name. For those patients that you're going to put on hold, it'll give you the patient name and tell you they're on hold. When you reactivate them during the same start of care, it'll tell you that. And then when you discharge the patient, you'll see that information sitting out here as well. So this is just a quick communication. I typically think it's a good thing to assign this to the majority, if not all of your team. And the only one I can think of that maybe wouldn't get it might be your HR person. But I just kind of find that it's useful going, oh, we got a new referral, ring a bell. Gee, we activated them, ring a bell, you know. Oh, darn, we lost that one. and so on. So I think it's a good idea that you assign this to more people than you would the case communications. Okay, and again, this is the same way. If you need to delete one or multiples, just select it and delete it. Okay, so that's pretty much how Workbasket functions. When you're assigning Workbasket, just remember that it's under Settings, Workbasket, User Rules. You will assign them based on whatever their roles and functions are, and it's going to tell you. Let me just grab one of these real quick. It'll tell you whether they have permission or access to the system, and if they don't, you will not be able to assign them that item. Now, just because somebody does have access doesn't mean you need to assign them Workbasket, but that would be your decision. Okay. So this actually concludes today's training. So I want to see if anybody has any other questions about anything you've seen today or over the previous trainings. Okay.